right. Thank you all very much. We just had a really nice board meeting with the Chamber of Commerce during our workshop, which is really nice. I am Cindy Simpson, Mayor of the Town of Mancos, and I hereby call to order the Town of Mancos Board of Trustees meeting for the evening of July 8th. Is it 8th? Okay, July 8th, 2026. The time is 6:01, and will everyone please rise for the Pledge of Allegiance and a moment of silence.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, thank you very much. All right, first item of formal business is approval of the agenda. I would entertain a motion in a second.
Make a motion to approve the agenda as presented.
Second.
Okay, we have a motion and a second. All in favor, say aye.
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 Like every day's a new day. All right, will the clerk please call the roll?
Mayor Cindy Simpson.
Here.
Mayor Pro Tem Brett McWhorter.
Here.
Trustee Max Levy.
Here.
Trustee Daniel Henning.
Here.
Trustee Ed Howell.
Here.
Trustee Andres Esparza.
Here.
Trustee Corey Tabor.
Thank you. Sorry, I did that in the wrong order. All right, so as part of audience business, staff was super nice and shortened it for me. Audience participation policy. All people wishing to address the board shall do so from the podium provided in the boardroom. Comments shall be directed to the Board of Trustees, not out to the audience or staff. Public comments regarding items not on the agenda shall be limited to 5 minutes per person. Public comments regarding public hearing items on the agenda will be limited to 3 minutes per person at the time the item comes up on the agenda. No person shall be allowed to speak until recognized by the mayor, and the board will not respond to citizen comments or take any action during audience business. They may instruct staff at the end of the meeting if further action is needed or desired by the majority of the board. All right, so first and only person on the list, Mark, Mr. Worth.
You guys need a tape or two.
Take it.
It's very difficult for me to understand exactly where our right out here is, which parts you don't need to
Wait.
So I probably want to just, well, I need to introduce myself.
Yeah, for the record.
Good point. I apologize for just out the road. Must be one of those days.
Sir, please.
I want to.
Thank you, sir.
My name is, good afternoon, Honorable Mayor and respected trustees. As you know, I am Mark Worth. My wife and I live at the location where your water is drawn from the Mancos River, where your settling ponds occupy 1 acre of our land, and where 1/2 mile of your pipeline across our property delivers water to your treatment plant and your taps. The property is located at 10750 Road 43, Mancos. The sheet I just handed you shows the state of Colorado record of the water drawn by the town of Mancos from the west fork of the Mancos River in August of 1961. 1961 is the summer following the signing of the Shepherd Agreement that allows the town the use of our property owned by my wife and me. As you can see, the State Water Commission recorded water flows up to 1.6 cubic feet per second throughout the month. The last half of the month it was only 1.5. The town's water treatment plant is completely incapable of processing that amount of water. You currently use less than 0.6 cubic feet per second. The over 1 cubic foot per second that was not used by the town came out of the only other large opening in the pipeline. That 1 cubic foot per second came out of this opening on our property because the unused water was called out in the easement 1 year earlier in exchange for the use of the land. Because the town did not list the property irrigated by this water on the town's water right filings, sorry. Your attorney is telling us that we cannot have this water at this time because the town did not list the property, or he says it's not available. The reason it's not available is because the town did not list the property irrigated by this water on the town's water right filings. The failure was not the landowner's fault. It was the responsibility of the town to maintain and defend their water rights so they could meet the obligations of the Shepherd easement and continue the use of the land. The other compensation for use of land was 2 raw water taps into the main flow line, 3/4 of an inch in diameter. 1 replacement tap into the new pipeline, plus 1 tap into the old pipeline abandoned by the town. Does not meet the requirements of our agreement. You see here a small piece of that abandoned pipeline that was left on our property. Clearly, this pipeline is no longer the main flow pipeline. Losing your ability to meet the intent of the unused water paragraph in the agreement was not an error made, or was an error made by the town of Mancos, not the landowner. As I explained 2 weeks ago, the town currently supplies 600 taps with less than 0.6 CFS. The 1 CFS no longer flowing on our property would supply 1,000 taps. My wife and I are asking for 1 raw water tap from the main flow line. The only cost to the town would be installing the tap. Because the tap is at the beginning of the pipeline, there's no infrastructure cost, there's no filtering cost, no cost at all to the town over the long term. We're asking for very, very little in exchange for the use of 1 acre of our land, plus a pipeline easement. And we believe this is a very modest request, seeing as how there's 1 CFS no longer flowing onto our land that would supply 1,000 taps. Thank you for your time.
Thank you.
Thank you. All right. Next item is Montezuma County Commission update. Thought I saw you walk in.
Good evening. I guess where to start, probably best thing is our administrator has resigned. So we're sending out notice of accepting applications for that position. Travis is leaving, going into another adventure, I guess. He's had enough of county politics, I guess. We actually did move Heath Higgins up to road superintendent this week. The other thing is the AAA board actually voted to dissolve that agency, which supplies your senior services, luncheons and stuff, the money for that. That's all that agency did, was a fiduciary for the senior services. We were out of compliance by 2 years with the state of Colorado and the federal government as far as things that were supposed to be filed. I just basically lost confidence that our management was going to get this stuff done. Kept telling us it was done, that wasn't done. So we decided to dissolve that agency. It'll be taken back over by the state right now for a short period of time, probably Region 9, and it should go back to our social services department running, which should help, because we will not be spending money on an executive director for this other agency. And so we should have more money for our senior services in the long run. It's gonna take a little bit of a headache here for a few weeks to get things straightened out, but that's where that's headed. Otherwise, most of you have heard how the elections turned out. So progressing into this fall, and hopefully we get a better turnout as far as votes this next election. But the other thing, I'm sure all of you are aware about these fires that are going on. Hope everybody's doing due diligence to maintain a safety as much as you can, because it's caused some serious problems. I've been landing most of the day treating animals that got caught in that fire over there. So it's a mess. And burns are a very serious thing to cattle because it takes their feet off bad. So they don't survive it well. And it's caused a lot of destruction for a lot of ranchers over there. A lot of those animals got trapped in those canyons and they couldn't get out. It's rough country and it's not accessible, and it's a big problem. So we haven't had as much problem with the animals getting trapped with this one here out in Dolores County, but that one over there has been bad. So that's about all I got.
Thank you very much.
Thanks.
Thank you.
Next item on the agenda is Southwest Health Systems update by Joe. Did I say that right?
Good evening. It's been a little bit since I've had the chance to give you an update, and really appreciate the opportunity. I'll go through something pretty quickly, but feel free to stop and answer some questions as they're pulling the presentation up. Hopefully what you'll leave with tonight is a sense of a couple things. Sorry, Mayor.
Name and address for the record.
Sorry.
Please.
Joe Thine, the Chief Executive Officer at Southwest Health System, 1311 North Mildred in Cortez.
Thank you.
Thank you. Hopefully what you'll leave with a sense tonight is some of the investment we've made in Mancos and how that's serving the community surrounding the town. Also, you'll hopefully leave with a sense of optimism in terms of when we put our mind to something, what we can accomplish, and then also a sense of uncertainty in terms of what's taking place in funding for healthcare in society at large that we have very little control over at the moment. Heather, are you going to navigate for me? Great. So a couple things, go ahead. A couple things on the governance side. So our board is, just as I was hearing you wrap up your meeting with the chamber, thinking about its future. We've got a great board in front of us. They've updated their bylaws to expand from a 7-person board to a 9-person board, and to extend their term limits from a maximum of 2 3-year terms to 3 3-year terms. When you look at hospital boards, our board is on the small size, both in terms of members and tenure. And just like you've got a lot of commitments as board members, hospital board members do as well. So they're looking to expand their governance size. We just, on behalf of the board, released some notices. So if you know of individuals that might be interested in applying, you can direct them to our website. Go ahead. So first I'll give you some updates on where we are operationally. And I'll talk, I believe, first about Mancos. So these are the current providers that are serving the community out of our clinic. 2 physicians, Dr. Eversol's here 3 to 4 days a week. Dr. Viquez is a family medicine obstetric provider. She's typically here on Fridays. Karen and Heidi are 2 family nurse practitioners that are here 3 or 4 days a week each. We're now open Monday through Friday. For a period of time, we didn't have anyone here on Fridays. That's when Dr. Viquez is here and when we're able to do some obstetric services. And part of that work in expanding both days of the week providers and obstetric services was with a goal to actually take care of more people here in the clinic. And from 2024 to 2025, we actually exceeded what we expected to in terms of patient visits within the clinic here. So I'm really proud of the work the team's been doing locally to serve the community. At the main hospital, we've also been looking at how we can expand care. And so beginning in March of this year, We've partnered with a group that's providing a hospitalist in-house 24/7 that's able to take care of kids from a newborn age through the end of life and in our intensive care unit. The group that we're working with is Rural Physician Group. Dr. Shane Martin is the medical director for that group and has been a great partner in transition, working with our nursing team, working to improve care. Really want to give a big thanks to the physicians, especially the outpatient family medicine and pediatricians that were providing inpatient services at the hospital, in addition to what I would say is their day job seeing patients in the clinic. And with the shift to having a physician in-house to take care of people of all ages, it really provides the family medicine and pediatrician physicians an opportunity to focus on outpatient care, and really is helping us retain some physicians that may have left if they needed to take call, and helped us recruit in some physicians to the area because they don't have to be on call for the hospital. So really helped us in that stability as well. We've also added some telespecialty services. So if we need to consult with a specialist when somebody's admitted to the hospital, we now have access to infectious disease and a pulmonary critical care physician. And starting later this summer, we'll have access to a cardiologist in-house. So it'll allow us not to have to transfer some patients that we'll be able to keep inside the hospital. This summer and over last year, we've expanded some of our outpatient services. So Dr. Nathan Clyde's a podiatrist who joined us about a year ago. We're just about to celebrate his first year anniversary and their family moving to the area. And then later this year, we're inviting 3 new primary care physicians. They'll be based in Cortez, but it'll be a great addition to the community as a whole. So we'll have a second pediatrician on our staff and then 2 additional family medicine physicians. When we look at our overall employee retention, we literally just benchmarked ourselves to some national averages, and we sit generally squarely within the national average for retention rates. You can see how things have ebbed and flowed. The line that goes across the top is really the rate of retention, percentage of employees we've retained over the last year. And then the little bars that go underneath that mostly are the number of separations in any given month. And you can see things have held relatively steady over the last couple of years, some ebbs and flows, but sitting roughly at a national average for hospitals and healthcare at the moment. So I want to turn a little bit to what's happening in the broad picture of healthcare for a moment. So when we're talking about hospitals in Colorado in general, and this is prior to the state reducing Medicaid payments, which began July 1st, and prior to the impacts of HR 1 that we expect to be taking place over a number of years, about 70% of hospitals don't have a sustainable margin in Colorado, and almost 85% of rural hospitals don't have a sustainable margin. Typically in a hospital world, we have equipment that we're having to replace on a routine basis. Everything from what heats the water to what cools the air to the MRI, CT, a bed that somebody's going to lay in to receive care. And generally, you have to generate in any, over a long period of time, 3 to 4% of an operating income to have the cash flow to replace your capital over a long period of time. And so what we're seeing in the current environment is that most hospitals in the state, big or large, don't have that sustainable margin to be able to replace the existing hospital and its equipment. The other piece that's happening, and again, this is pre-changes to the Medicaid program, we've continued to see more and more people in Colorado that are unable to afford their care and are eligible to receive care at a free or reduced cost through the charity programs that hospitals offer. I think that's a sign of where we are at the moment in terms of increasing costs for all of us as consumers. The cost of housing, transportation, gas, all of those things are consuming people's disposable income and making it harder to afford or pay for their health care, especially when they don't have a source of payment, Medicare, Medicaid, or insurance through their employer. And here's where that's left us over the last couple of years. And I'll talk a little bit more about why these things are true. So up until a couple of years ago, we operated with a margin that our expenses were outpacing the revenue that comes in. And that's setting aside the tax that we have within Montezuma County. In 2024 and 2025, based largely on more people seeking care and also some of the benefits that we got through the Medicaid program, we were able to put together 2 years of an operating income. We expected this year that to be a little bit more modest, but we still expected a positive operating income this year. And what we've seen through the first 4 or 5 months is actually a significant operating loss that rivals the losses from about 4 and 5 years ago. And we'll talk a little bit about why that's the case. This shows by some broad service areas what we expected in terms of the number of patients coming in relative to a year ago. And you can see that blue line, we expected some modest growth, nothing extravagant, nothing really remarkable. And what we've actually seen so far this year is fewer people coming and accessing care. And we looked across a variety of ways that we can see who's coming, who their payer was, whether it was commercially insured, Medicaid, Medicare, looked across some demographic information, is it older, younger, male, female. And anytime we looked at the data, what we found was it was pretty much the same across the board. And so some of the concern we have at the moment, given the economic conditions, is that folks are just holding on to their wallet at the moment. Healthcare is something that if it's not urgent or immediate, they may be postponing and not coming in for some of the routine things that historically they have. And that becomes a force that's largely out of our ability to influence significantly as a hospital or a healthcare system. That said, on the surface level, we're maintaining our cash position. And so you'll recall from several years ago, we've got a requirement from our bondholders to maintain a certain amount of cash as a part of our covenant with the debt that we hold. And we've been able to exceed that for the last several years. We both worked with our bondholders 2.5 years ago to make some changes to that are a little bit more favorable. They place trust in how we're operating the hospital to be able to do that. And we're currently sitting at the end of April here with around 110, 111 days of cash on hand. If we go to the next slide, we really have to dig into what that cash is being used for. So 60 days of that cash we need to hold in reserve for our bond debt covenant. A few additional days are in a kind of a separate piece that's also tied to that bond debt. The other thing we did about 3 years ago was restructure the debt that for 40 months sets aside part of the payment, puts it in a restricted fund that can only be used to replace things on the facility itself. So think HVAC, think boilers, think large things that in the 1970s era building are long out of their useful life. And so that fund has been accumulating, but that fund can't be used for anything else. We can't use it for daily operations. We can't use it to replace other equipment in the hospital. We've got a few other things that internally we know we're going to have to use that cash for, some capital equipment that we've committed to purchasing and some other things related to operations. And when we pull all of those things out, we're operating as though we have about 7 days of cash available to us. From a management side, our board has asked us to make sure we maintain a cushion so that we don't find ourselves at odds with our bondholders anytime in the near future. So they've really asked us to operate as though we have 65 days of cash that we need to hold that are not in reserve. So from a management side, we're operating the hospital as though we have 2 days of cash available. So that's, even though our financial position and our balance sheet's very strong, we're not in a position where we have to overreact to things. If you hear staff or others that live in your community, they're like, gosh, we really want this nice new thing. They've got so much cash, go buy it. We're really operating the organization as though we're cash poor to make sure we don't erode that good cash position in the future. Go ahead. Even with all that, we've been really focused on the quality of care we provide and making sure our story gets told. And so these are some headlines that have been published just since the beginning of this year and some recognition that we've received for the great care and great work that our providers are doing each and every day. So I want to shift gears away from kind of like our daily operations and tell you how we're thinking about the long haul for us. 2 years ago, our board did some planning, really looking out over a 3 or more year horizon, and gave management some really clear direction. We exist for 2 simple reasons. One is if you live in the communities that they're part of our area, we should be helping improve your health. The second is if you live, work, or drive through the area for whatever reason, and something bad happens and there's a healthcare emergency, we should be here to help take care of you. And so a lot of our efforts and focus have been around those 2 areas within the resources we have. To do that, we've really focused on people, knowing that it's those individuals that are at the bedside or supporting them that are the ones delivering their care, creating the environment where we can attract and retain great people to do work. When we have the right people, we continue to improve the quality and safety of that care. It attracts individuals who want to receive care from us, and we can continue to sustain and grow services. So the large metric that we share with our board around how we're doing in terms of improving people's health, I can't stick a probe in any of you and it's going to tell me like as a healthometer like what your health is, like a thermometer might. So we have to look at what are some reasonable proxies. And one of the proxies we look at is, do people have access to a primary care provider and are they using that? And we know we're not the only primary care provider, so we wouldn't expect the whole population to see us, but we do think there's people that are under or unserved that we should be reaching. And so what you're looking at here is an attribution of people who live in our service area that have seen one of our primary care providers at least once in the last 18 months. That's how we're defining somebody accessing primary care through us. And what you can see is over the last 18 to 24 months, that's largely been growing. We think we know why there's a kind of a dip and then a resurgence in the last couple of months. It has to do with if somebody didn't see a provider over a couple of years ago and haven't rescheduled something, and we have some ways we're actively reaching out to those patients to pull them back in. And on the emergency side, we look at a couple of things for our board. One is if somebody has an emergency and they present in our emergency room, do we see them? And there's a national standard that we recognize some people may show up and then leave for a variety of reasons. The national standard is that less than 2% of people who present to an emergency room would leave without some treatment. And what you can see here is that most months we're about half of that. So it's about 1%. Occasionally we bump up against that 2% line, but it's largely well below the national standard. What you won't see published in your packet or here is also some other things that are really meaningful to patients. Our door to physician time in the emergency room sits around 10 or 11 minutes. So if somebody presents at our emergency room, the time between them seeing a doctor and walking in the door on average, doesn't mean it's everybody, but on average is about 11 minutes. And the average length of time that people spend in our emergency room sits right at or under 2 hours. National averages are about 130 minutes, or sorry, about 3 hours of time spent in an emergency room and at least 20 minutes from a door to a doc. So we have 14,000 people that come into our emergency room every year and we treat them more quickly. We have more people that stay and get treated and we're having them have to spend less time of their life in our emergency room than the average emergency place. Some other areas where we've been really intentional, and I'll just touch on a few statistics, are cardiology and oncology. So 2 years ago when we looked at what unmet needs are there in the community that we might be able to make a difference on, one we identified was not having a physician on an outpatient basis that's a cardiologist. And as a result, a lot of people would leave the community to get cardiology tests that we could perform here. We've been working more closely with a cardiology group out of Montrose. We've expanded the number of days a month that there's a cardiologist available at our offices in Cortez. And what you can see as a result of that is for echoes, and then on the next slide for a couple of other tests that are also very common for cardiology patients, that more people are ending up getting the tests done locally rather than having to travel out of the area. On the oncology side, we partnered really well with the oncology program in Durango at Mercy. So just a little over a year ago, we invited the oncologists, their advanced practice providers, and their leadership team, some of whom flew down from Denver, to come visit our hospital. And we asked them if they're going to come visit, we would like one of two things when you leave. One is if it were your mom, your dad, your brother, your sister, your aunt, your uncle, and they lived in or around Cortez, Mancos, Dolores, and they needed chemotherapy in our infusion center, that you would trust us with your family, instead of asking them to drive back and forth from our community to Durango several times a week for chemotherapy. If you wouldn't trust us, tell us why and help us fix it. That was it, really simple. Otherwise, don't come. We'll find somebody else that wants to help solve this. And the team came and they said, wow, we had no idea. They looked at how we would respond if somebody had a reaction to a medication. Our nursing team, our pharmacy team, what they found was that our nurses and our pharmacists have the same level of training and experience that the oncology team at Mercy does. They found that our ability to respond if there were to be a reaction to a medication that was unexpected was equal or better than what they had in their own clinic. And what we saw from 2024 to 2025 was almost a doubling of the number of people who have cancer that we treated within our walls. And what you're looking at here is the number of unique chemotherapy agents that we used in our infusion center. And historically, we've only used 2 or 3 different chemo agents. And as we built the relationship with the team at Mercy and their oncology, last year we used 16 different agents. That's not just a simple like, oh, we'll refer the patient. That's 2 groups working together. Our pharmacists making sure we know how to prepare the medication, the nurses making sure they know how to deliver it, the oncologist trusting us with their patient and trusting us to take care of someone as though they were their friend or family member. These are 2 areas where 2 years ago, we knew we could make a difference for people living in the community. And as I said earlier, when we put our mind to something, we know we can make a difference, and we have. The other place that we've worked on this year is merging our 2 record systems. So historically, if you were a patient or a provider and you were seen in the emergency room or in our clinic, we got to look in 2 different places for records. And it's not like at home where maybe we have 2 different drawers that both kind of pull out or push in about the same way. It's kind of like going to a friend's house and asking them where their stuff is in the kitchen versus our house. It's like looking in 2 different places. And by unifying that record system, as things start to move forward, as a patient wants to access their information online, they'll start to have one place to go for all of their information. It's not like they're looking all over the place in 2 different homes. And similarly for the providers, if we have a patient seen in our emergency room, they can see the record for all of their outpatient care without having to look somewhere else. And then when the patient's going back to receive their care out of the emergency room or out of the hospital, everything's all in the same place. That started in the middle of March. We've gone live. And I'm really proud to say our team's done a great job with that. We've maintained really good access throughout that whole change while training our staff and getting used to new systems in-house. Lastly, I'll touch on kind of some of our capital investment and future funding. So we've been doing a lot of work, not only inside of our walls, but outside from an advocacy side. So in the most recent appropriations that was passed at a federal level in January, February of this year, some funding's coming to us, $1.9 million that was spearheaded by Senators Hickenlooper and Bennett. It's going to help us replace our CTE, which is a really critical piece of equipment in emergencies, but also for a lot of outpatient things. When we replace that, it'll be upgraded and we'll be able to do some advanced cardiac imaging as well. So again, it's going to expand that cardiology program. It'll also replace some other imaging equipment that'll expand some of our capabilities and help with the construction. So when you see our senators, please thank them for the work that they did back in DC. And then Congressman Hurd this year prioritized on his list of things replacing our ambulance fleet. We run the ambulance more or less from the county line, and sometimes we're co-responding all the way to the border in Utah, all the way up to Lizard Head Pass, sometimes co-responding with Rico, and sometimes all the way to the U-Mountain Ute tribe. We got some word this week that maybe the congressman's colleagues haven't prioritized it at a federal level. We're waiting to hear that officially, but this may take some time and a couple of years' work to get some federal funding, but we'll stay at it. We've also got a really unique opportunity. We were looking for ways that we could save money on a day-to-day operations basis. And across all of our facilities, we spend almost $1 million a year on electricity alone. And when we started looking at federal and state funding opportunities, we asked ourselves a couple years ago, what would have to be true for us to generate our own power and store it? We found some federal funding to store energy, but not to generate it. That may be a later day. But through some good work and some federal money that passes through the state through the Department of Local Affairs, we were able to get a Department of Energy grant. And that wasn't actually going to provide enough funding for the district board to say go. And when we reached back out to the state and let them know we may have to decline the federal funding, they said, hold on a moment, let's see if we can match it at the state level. And there's some state matching money. In order for it to be made available for this project, it required a waiver from the governor around some stipulations, and the governor waived those in order to make sure the match would come down here and we could secure that federal and state funding. So currently we're underway on a project that will allow us to store enough energy on site to save us a couple $100,000. I think the current estimate's about $120,000 or more a year on electricity. Doesn't sound like a lot, but that's more than a staff person's salary, wage, and benefits over a year. What will happen is we'll draw down from the grid with Empire. We'll store energy. We'll purchase it when it's off peak. It'll also shave down our peak demand, so lower our base rate, and then we'll redisperse that back into use when it's at a higher cost. The other thing it's doing is it's creating resiliency for the hospital. So we have to have, by regulation, certain parts of the hospital backed up 24/7. Currently, we do that through a diesel generator, and so if we lost power from the grid, we would be able to run essential services in the hospital, but not everything. The way that we're designing the battery storage system is it will act as a backup in parallel with the diesel generator so that the other areas of the hospital that wouldn't be receiving electricity in a complete power failure will for a period of a couple of days. So we'll be able to serve the community even more broadly with that if we were to have a power outage. Our cost from a district side is a couple $100,000 a year on a multi-million-dollar project. It'll get recovered within a few years pretty easily. And then these are other areas where we've got some capital that we're spending this year, some other things that we're looking at down the road that are more infrastructure out of that fund that we've been building up over the last couple of years. We've also been working with DOLA and some other places to get match funding for some of those projects. So many of those are in flight or underway. Last couple of things, the Rural Health Transformation Fund, you may be hearing a lot of rhetoric and headlines and things like that. And if you're not sitting in the healthcare space, I would say it's really easy to be like, wow, this is great. We've got a generational large sum of money coming to rural hospitals. I want to temper your expectations a little bit. So the expected losses from Medicaid funding that are going to occur between now and 2023 are going to outpace what's coming through the Rural Health Transformation Program. And Colorado's got about $200 million a year coming in over the next 5 years. Of that, only $160 million is actually getting pushed out to local communities, and it's not all hospitals that are receiving that. It's a variety of other eligible entities. And what you're looking at here is earlier when the state was putting together its projections of how they were going to be accepting and processing applications, the bucket of money that they had that was dedicated only to hospitals. We can apply in other areas, but the bucket that was only for hospitals was sitting at an amount that if they awarded 20 grants, each hospital would receive $200,000. There's 45 or more rural hospitals in the state that are eligible, and so the state was forecasting that they may only award half of the hospitals, and $200,000 is a drop in the bucket compared to the funding deficits that we'll see. So we've got a lot of work on the advocacy front to do. I truly believe our elected officials, when they set aside that money, intended it to go to rural hospitals. That was what was said last summer, but what has really transpired and happened is not what I think the legislative intent was. And so as we work with our senators and our congressmen, we're continuing to ask them to ensure that the agency, CMS, that's overseeing this really works hard to get their legislative intent, and then actually to see what other funding the feds can appropriate to make sure that that funding intent is met and that rural hospitals continue to be supported. So we had a really good plan 2 years ago. Good plans, only last so far, and we're getting punched in the face at the moment. We asked earlier this year, we actually got some pro bono work done. The advisory board's a nationally known healthcare advisory group, and they wanted to do some work for rural communities to help them understand what their position would look like. And so they did some things at no cost for us. And what they found when they looked at our current financial position, they look at where our payments come in today, what's going to influence us financially from that HR1 passing, all the different levers that affect Medicaid. Where will we be if nothing changes at the end of the implementation in 2033? And what they reported back to us was we would have $9.6 million less of an operating income than we do today. So take that 1.6 million that we're experiencing halfway through this year. Let's assume that's where we end the year. That puts us at a delta that's 11 or $12 million a year. We can't sustain all the things we do today in that environment. And so, I've been very public. We're not going to talk about what we might do, but we are working with our board to really try and understand What are the critical services that help improve people's health? What are the critical services that make sure if something bad happens that we're here to help take care of you? And then we are working on how do we keep closing gaps in care where we can generate more revenues than the expense so that we can fill in that hole over time and hopefully never find ourselves in a place where we have to come back and say we have to stop doing something. But we have to move down two different tracks right now, given the realities and what's coming towards us and what our community needs. So the last thing I always leave groups with is if we continue to work together both on an advocacy side and encouraging our friends and families to receive care at their local hospital and their local clinic, we work with our elected officials on an advocacy side, we can continue to paint that beautiful picture. We can continue to do things like expand oncology, cardiology, and other services. If we all get in our own little silos and do our own little things, it gets really hard really quick. So my encouragement for you as a town, you sit really in between two great hospitals, two great places to receive care. As you talk with your friends and family, the services we provide and value that are here in your clinic in Mancos and that we have at the hospital exist when people choose to get their care there. When we export care to the neighboring community that they could have gotten just literally 20 minutes from the main light here to a hospital, we put at risk the thing that we rely upon every day as a community. So, thanks for the time. Happy to answer questions, and I appreciate all you do for the town.
Any questions? All right.
Thank you again.
Thank you so much.
You're welcome.
All right, next item on the agenda is H, announcements.
I do have a couple of vacancies coming up, July 24th to 26th. Town hall is closed again on Thursday and Friday. The admin office staff will be here, but we lock the doors. Just so that people will go to the Vegas Days Committee with their questions. So we use those 2 days to do some non-public facing work, striking records, and that kind of thing. I do want to remind everybody that we are currently pulling off the river for our water. So I know we have watering restrictions in effect. Staff is going to continue to publicize that. We are strongly encouraging everyone to conserve. Water out of Jackson is more expensive to treat. So I met with Kyle today, our plant operator, and he just could not stress enough that we need to really conserve where we can. Currently, watering restrictions allow even in non-watering. So we're going to continue with that. Depending on how long we pull off of Jackson and what water looks like in a couple of months, if we need to adjust that, we will, and then we'll notify the public and we'll notify you all. But when you're talking to people, please encourage them to conserve water.
Are we pulling off the lake or the river?
Jackson Lake. So.
Okay, you said the river, so
Yeah, I got
I thought we went back or something, so just making sure.
And we don't anticipate, usually.
Yeah, we won't go back.
Behind the scenes, like our code, our ordinances state, starting May 1, voluntary water restrictions, starting June 1, mandatory water restrictions. It's just in our code. Behind the scenes, our water gets called and we pull off. We no longer pull off the river, we pull off the lake, and then we have some monsoons, and they're like, oh, okay, go back to the river. We do not put that out to the citizens because they're. Sometimes I'm calling Kyle, are we on the lake or the river today? So this year we don't anticipate going back on the river like we usually do. So please encourage people to conserve, and then staff is working on some additional public outreach, same information, just maybe a different way to catch people's attention. And then I don't know if there's any update from the CMO conference.
Well, we attended a lot of sessions. Still formulating thoughts in my head. Max?
Yeah, I mean, I found it really valuable. I know one thing I took away was a session that Westminster put on regarding their Hello Neighbor campaign and just kind of being more public facing as trustees and like meeting people where they're at rather than waiting for an issue to come before us here. So I would like to maybe kind of explore some strategies around that and how it can be more like out in the community. Meeting people where they are.
It's a workshop topic.
Yeah, I would love to make that a workshop topic.
That'd be great.
That's something soon. All right. Any other announcements? Okay. Then, moving on, we'll get to our consent agenda. And I would entertain a motion in a second.
I'll make a motion to approve the consent agenda items as presented.
Second.
All right, we have a motion and a second. Did you hear who they both were? Okay, yes.
Yeah, I'll get
Speak up a
closer.
little. We're talking to the people.
Usually
Thank
there's
you.
nobody here, so.
I know. All right. All in favor, say aye.
Aye.
Any opposed? All right. Item J, discussion and action items. The first one up is Stray Dog LLC, DBA Moondog Cafe, retail liquor license renewal.
So they actually got their application into me very early, which I truly appreciate. As you can see in your packet, that they don't expire until September. So this is just their normal every year thing that they do. We haven't had any issues with them over the last 12 months.
Now, this is public hearing.
No.
Okay.
Next one.
Okay.
Next one.
It's just a renewal. Okay. That's, just wanted to clarify. All right. Any questions of staff? All right, I would entertain a motion and a second.
I make a motion to approve Stray Dog LLC retail liquor license renewal and authorize the deputy clerk to submit the renewal application to the Department of Revenue.
I'll second.
All right. All right, we have a motion and a second. Will the clerk please call the roll?
Mayor Pro Tem Brendan Porter.
Aye.
Trustee Max Loving.
Aye.
Trustee Daniel Henning.
Aye.
Trustee Ed Holland.
Aye.
Trustee Andres Esparza.
All right, thank you. Next item is public hearing. So I open it now. Yes. It's a little confusing. The time is 6:48, and I hereby open the public hearing for Millie's Mancus LLC retail liquor license application.
So as you guys know, Millie's did open up. We do have a couple of their owners here. If you guys have any questions for them, it's kind of like all the other retail liquor licenses that you guys have seen before you. They're just asking for one for their facility.
Okay. All right. Did you want to come up and say anything? Do we have any questions for them? They're like, heck no.
We don't have to.
Please come up. No, no.
Can we just say that we had a great opening and people are very enthusiastic about it and it's been a wonderful 2 months.
Good, thank you. Oh, yeah, and we did have the petitions.
For and against, we had none against, we had signatures for.
Yeah. All right, any discussion?
Close the.
Okay,
Public hearing.
I will then close the public hearing. The time is 6:49, that was quick.
It's a long public hearing.
Yeah, that's forever. I would entertain a motion and a second.
I make a motion to approve Millie's Mancus LLC hotel and restaurant liquor license and authorize the deputy clerk to submit the liquor license to the Department of Revenue.
Second.
Okay, we have a motion and a second. Will the clerk please call the roll?
The question, was that you that seconded?
Yes.
Okay. Mayor Pro Tem Brendan Porter.
Aye.
Trustee Max Loving.
Aye.
Trustee Daniel Henning.
Aye.
Trustee Ed Holland.
Sure.
Trustee Andres Esparza.
Aye.
Okay. Next item up is the ordinance 794, series 2026, sales tax increase ballot question.
So, this ordinance is required for us to coordinate with the county. At the last meeting, you gave approval for me to notify the county of our intent to collaborate or to coordinate. This is the actual ordinance with the actual ballot language that will be presented to the public on the ballot in November. I would like to clarify that while we are coordinating with Montezuma County, only residents of the town of Memphis limits will be eligible to vote on this sales tax question. And what we are proposing to them is a 0.4% increase in sales tax only. The town does not have a use tax. And that will be restricted to streets and broadband maintenance, operating, and capital, if it is approved by the voters.
Okay. Any comments, questions, concerns?
No.
I think
I think we've talked about it enough and postponed it a couple different times, so I think the last time we had an increase was in 1994, so I think it's probably time for us to do that.
Yeah.
And probably the number one item I hear from people is road maintenance when I'm out in the street, so so if nobody else has anything, I'd make a motion.
I would entertain that.
I make a motion to adopt ordinance 794, series 2026, an ordinance of the Board of Trustees of the Town of Mancos, Colorado, authorizing the submission of a proposal to the voters of the town concerning the imposition of an additional sales tax of 0.40% upon the sale of tangible personal property at retail and the furnishing of services.
Do we have a second?
Second.
All right, we have a motion and a second. Will the clerk please call the roll?
Mayor Pro Tem Brett McWhorter.
Aye.
Trustee Max Levin.
Aye.
Trustee Daniel Hennick.
Aye.
Trustee Ed Vaughn.
Aye.
Trustee Andres Esparza.
All right, motion passes. Item number 4 is ballot question public outreach information.
Okay, this is a separate item on your agenda because now that you have approved your ordinance, which you no longer advocate for the sales tax increase, you may provide information when asked, but it must be neutral information. So what I have included in here is some of this information you have seen before. We did conduct a community survey, and there was overwhelming support. I included that information because some of the current trustees weren't seated at the time. I included some very specific comments from citizens that we received when we were doing this survey. Just to refresh your memory, the original survey said, if we do a sales tax increase for streets and broadband, would you support it? If we do a sales tax increase for law enforcement, would you support it? And both received overwhelming support. However, after discussion, we desperately need to increase our revenue for streets maintenance and for broadband fiber. So that was the direction that the board chose to go. So that is why the current ballot is restricted to streets. But you will see in the survey questions about law enforcement. And then you'll notice there was overwhelming support for that, which was very nice to receive. At this time, we chose to go in the direction of streets. So I have included information in here that I am more than happy. I want to make sure there are no questions, and if I need to clarify anything. But once this discussion is over, if we finalize the discussion and I receive any questions, I will be creating an actual document that you all can have, that staff can have, because it's not just the board who can no longer advocate for this. We cannot spend public dollars anything here. We have to be confidential. So if there are any questions, if there's any clarification, if there's anything you want me to come back with, please let me know. Otherwise, I will use this information to create a document that you all can have with you or on your email or whatever. We'll put it at the front desk and staff can use them as well.
I had a couple of things.
Yes.
One is we seem to bounce back and forth between a couple different ways of stating the increase we're requesting. Like sometimes it's 0.40%, sometimes it's 0.4. And so maybe if we just kind of pick one, stick with it. And then in item number 4, comparison table, it has current sales tax 4%, proposed sales tax 4.4%. That was confusing to me because I was like, whoa, what? That's the total. So if we could maybe clarify and have current sales tax, proposed increase, and then proposed total. I think that would clear it up. Anybody have anything else? All right.
I wonder if, I know we're not supposed to advocate for, are we able to share projections of what it would bring in? And I guess that's the question for you, and maybe the question for the board is that, would that be helpful? Or was it better to leave those projections off?
We can't state them for or against.
No, we're just saying.
Yes.
Yeah,
What it
this
would
is
bring in.
anticipated.
This is anticipated. Would that be helpful? Is it allowed?
So
It's difficult.
I believe on the survey it projected something, right?
it does
like
project in the
100K.
survey, which
So
is great.
information is there.
Right.
So we're not having to do anything.
The ballot question requires that we say we anticipate collecting this much in the first year. And Tabor requires that if we collect more than what we anticipate in the ballot question, we have to return. So I would be very careful throwing numbers out there. Just because the ballot question has a number that was very carefully chosen. We do not want to mislead the public, but we also would be hard pressed to return overages in sales tax because the state collects on our behalf. So yes, it could be done. We would have to hire a consultant. You know what I mean? It would be a longer process. So I would just be very careful throwing a number out there. And maybe what I will do is include the proposed ballot language in the information that I hang out to you because I believe that has the information that you're looking for.
That would be everything, yeah.
Okay.
I have a question.
Yes.
Instead of a number, could we just put that the average time to collect to do a road would be a certain period of time, like 2 to 3 years or something like that? Because that was in the survey at 1.2.
Yes,
It
like
was
one
in the
block.
survey. Those numbers, my concern is those numbers are based on today's road costs.
Right.
So even the road costs that were in the survey are low now because it was 2 years ago.
Yeah.
I do think though, like with, under the purpose, it just says street and broadband. Maybe we could give some specific examples of what street looks like. Are we talking paving, sidewalks,
maintenance,
that sort of thing, without throwing numbers at anything, but just so people
of
can
improvements.
conceptualize it better.
and then for we even have that today with broadband,
Right. Yeah, that was
infrastructure.
helpful. Yeah.
Something just a little more of an explanation, I guess, than just streets and roads and broadband.
Yeah, because everybody's first question is why, and then what's in it for me. So if we can, kind of.
I think the point of, we haven't done anything to our sales tax since '94. I don't know if that would be seen as a pro statement, but I think it's an interesting.
We published that information and the board had a booth at Vegas Days last year to provide exactly that information.
Right.
And here's why we need this, because at the time the ordinance wasn't passed.
Okay.
Yeah.
So you have much more leeway as to what we could provide.
Right, okay.
I would be very careful as to why do we need this, because that is more of it's not a neutral statement.
But if you just say the last time we raised the sales tax was in 19.
When was the last time it was raised? Could we just answer that and not be advocating?
I'll verify that. We have a special
I
believe you can.
Because it's just a statement of fact. It's not necessarily advocating either way.
what I'm going to do is I'm going to take the information, the public information that we utilized last year during Vegas days, and I'm going to make that topic neutral. So I believe that we can because it's a fact. You're not saying please vote for this. You're just saying the last time we increased it is this. That's data. It's public record.
Yeah.
So I'm going to take that information and make it content neutral, basically.
Yeah.
So I will make sure that the last time it was raised is in there just as a fact.
Because that's going to be a question we're going to get, definitely.
The other thing that we need to do is we need to be very upfront and forthright in the fact that, because we are board members, this is a situation where we can speak neither for nor against. Make sure that people understand that so that they don't feel we're stonewalling them.
Right.
Explain by law, it is illegal for us to discuss, a pro-con scenario because otherwise people are going to just think, well,
why are you being so cagey?
Yeah.
Yeah.
Which is
upfront and say, by law, we're not allowed to speak for or against this scenario. The facts are the facts that you could pick up at town hall. I would recommend that you go there and get that pamphlet. And therefore, I can't really speak, in favor or against because of a legal, stance. And that way they'll understand it, but I think we should steer them to pick up the paperwork from town hall. Not because what happens, what I find is that if we have that pamphlet and we start discussing it, they're going to say, well, what about this? What about that? What about this? We need to defer it away from us as much as we can so that we don't get caught in someone saying, well, I really, and then boom, there.
Yeah.
People will try to work around it.
Thank you.
I was just going to say, once we do get that neutral pamphlet made or whatever it is, would it be possible to also put it at some of the businesses downtown for people to pick up elsewhere, or?
Absolutely. I will also put copies in front desk, so if anybody wants to pick it up and recreate it, they're welcome to, because it will be public information. And then I will also send it to the chamber of the Drainage District. Cool. So they can publish it on there if they choose to.
Yeah.
Give us a little QR code. We just hand it to here. Here.
No, nobody uses those.
I hate those things.
I know, but I hate them too.
All right. Okay. Any
All
other?
joking aside, are you serious about the QR code?
No,
No.
not at all.
Okay.
That'll take a little bit longer.
Okay. I just want to run across the board here. Daniel, anything else to add?
Nope.
Okay. Max? Brent? Ed?
Okay.
All right.
Thank you.
Sometime next week, I'll bring this out to you.
Okay. All right. Next item up is Mancus trustee protocol discussion. So we had a very, very long protocol document, and I thought, you know what? This is really hard to read. It's I found a couple sections that were kind of in conflict with each other, and I just felt like maybe we should try to consolidate, make sure that we didn't duplicate, make sure we didn't leave anything out. And so the results are in your packets. And I just thought if we had taken a look at it, we could talk about it tonight. There's no rush. I mean, it's just for us, and and if we haven't all had a chance to look at it, then we could postpone to another meeting. So, what do you guys think, Andres? We'll start with you.
Are you looking for specifics within or just discussion in general?
Right now, just are you ready to talk about it?
Maybe yeah, I think so.
Okay.
I'm open.
Okay. Yes, next. Daniel?
Yeah, I didn't quite be able to get to your updates on here on page 100. I didn't get to finish
Okay.
all of them. So I was looking at our old protocols and I got hung up on some of that stuff, and I was like, like, so I guess, I don't know, when you rewrote this, did you take out all the stuff that says we can't disagree with each other? Because that's,
I don't think
because
so.
when I read that in our old protocols, I was like, how did I not catch this? But it basically says,
Yeah.
you can't disagree with each other, and I was like, well,
What?
none of us would agree to that, so, but.
Right, yeah,
Yeah.
that's like totally against the point. So, yeah, I
So
tried to clean it up. AI helped, I'll be honest about it. Cause it was a huge document and I know that at various times we've all sort of made a complaint, about how big it was and, unwieldy. So,
Yeah, I like that you shortened it.
Yeah, thank you.
That's,
Yeah,
I'm a big fan of removing unnecessary language
Paper.
from things.
yeah, cause, you know, it was 23 pages, now that's, I don't know,
6.
6.
Yes.
So,
I think
do you feel like you're ready if we talk through it? Sounds like Andres has specific things.
Sure,
Which
yeah.
I would like to hear.
Yep.
We don't have to do anything with it tonight, but I would like to hear any kind of potential edits, and then I could edit it and then run it past us again.
And I don't know if I have anything super in depth, but
Okay.
maybe to Daniel's point, I think under board member conduct, I think it might cover what you were talking about. We can definitely disagree with each other. Just have to keep it simple, which I think is perfect.
Yeah.
I think the way it's listed there is perfect. I was more clarifying, and again, apologies if it's written, I just didn't catch what it is. For remote participation, you know, obviously we can't vote in quasi-judicial hearings, but we can otherwise vote. This is a little bit separate from the conduct here, but just trying to make it a better system in general to encourage that so that we can do it. I think as it's written, our protocols allow us to participate if we have to travel for work or some unforeseen circumstances, but the way the system is set up physically makes that difficult. And I'd love to be able to match the two.
Like better tech and.
Better tech, yeah.
And
Yeah, we've been
So it's
talking
not so
about
much in the
that.
protocol, it's in the.
Yeah, exactly.
And I
Yeah.
think that's something that we've talked about in the past.
Yeah.
During budget season as well, of like finding a better method than the current one, because with the space phone, it's really hard for us to hear on that side, and for us here, there's a delay, and it's just, if multiple people are talking at once, you don't hear really any of it. So I think that's something that we have to approach, not necessarily from a protocol standpoint, but during a budget discussion about that.
Yeah.
We talked about it a little bit at the retreat, and then I've done a little bit of research, and we are trying to figure out how to make this room better from a sound standpoint.
Yeah.
I'm going to borrow an owl, but first we need to.
The camera, right, not the bird.
I'm sorry.
So the camera, not the bird.
Correct, yes, sorry. First we need to figure out the echo on the walls, then I'm gonna borrow an owl. Because we could go full board, but you're looking at $250,000
Yeah.
for a perfect room. And that's absolutely fine if that's where you want to go. And we can maybe talk about that at the next meeting, to talk about capital for 2027.
Yeah.
I will be honest, it's not on staff's list. That doesn't mean it's not on your list. The reason that we're going to talk about this is here's what staff is thinking, what are you guys thinking? So we can talk about that at the next meeting, to see if that's a priority.
Yeah.
And we'll make it a priority.
I think we should. Yeah.
So
At
right
least
now,
talk
when
about
we
it.
talk about capital, and we're doing it at the meeting, not the workshop, because you're having a joint workshop with the creative district. So the meeting itself, we will talk about 2027 capital. So bring that from the board standpoint, because we'll be presenting stuff.
Perfect.
Okay. That's right. Anything else? Just check. Ed? Anything? Did you notice anything?
So in rules of order, it says, once the board votes, trustees agree to move forward without revisiting the issue or criticizing the decision of fellow members. And I think that we all should retain the right to criticize, because that's part of healthy debate.
But once a decision is made, we have to
Well, yeah, but then you're saying,
by it.
well, the board makes a decision, that doesn't mean that or doesn't agree with the board's decision has to support it. Because that's what was in that,
I think the word criticize is probably, to disagree is once, but to criticize is, they're two different things. I think if you're criticizing, you're basically putting it down as something that they did wrong. If you disagree, it's a belief that you don't agree with their decision.
Well, criticism is not negative to me. It doesn't automatically have a negative connotation. Criticism can be constructive and productive.
It can be, yeah, constructive criticism, but unfortunately, the word criticism tends to take a negative stance.
Yeah, and here's the thing, to Brent's point, once we voted on it, the debate is really kind of closed. So it wouldn't necessarily be before or during, it's just more after. And I think that came from CML, meeting protocols.
CIRSA.
Okay. So I will take a closer look at the CIRSA information and make sure that our language is right. Because that's a good thing to make sure that we're.
I mean, to me, that's just, criticism is just, that's dissent, that's just disagreement. So if we're using that word, then maybe we want to tighten it, to try to, communicate the intent better, because I can imagine several instances where we would all want to criticize the decision, or several of us would have criticism of decisions that this board has made. And I don't think that any one of you should be forced into supporting a decision that you didn't agree with. And I wouldn't want to be forced into holding my tongue and not being able to criticize a decision that I didn't agree with.
Are you talking about like public, like to the public, or?
Yeah, I mean,
Because
this
I believe that's where
doesn't
that
say
was
it.
coming from.
Yeah,
Maybe
it doesn't define anything. It just says move forward without revisiting or criticizing. So it could be to your loved one, to your friend, to whoever is in your personal life. That's your freedom to speak right there, what you want to speak. So I don't see that as something this board could enforce.
So maybe it's more. I'm sorry.
Go ahead.
I was just gonna say, so maybe it is more of a, because I mean, as someone who's just recently onboarded, I remember this conversation being more of a, once we make a collective decision, whether you dissent or you vote aye, we move forward and you don't go out in the public and create divisiveness by trash talking the other board members for having a different position on something. It's more of the public perception and creating a wedge amongst the board, right?
Yeah, I agree. Yeah, I agree with you there, which is different than what that says.
Sure, but that's what I'm saying. So maybe that's where
we need to change the way that it's worded.
Yeah.
So I'll check with, I found
CIRSA.
some here, and I'll check with the CIRSA.
Yeah, like maybe advocate against the board's decision or something, like, you won't actively undermine the
authority of the board.
I mean, because, you can talk about it respectfully that you disagree. And
I've
fine,
disagreed
but
about things in the past, and I've been able to say, I didn't necessarily agree with the board at the time when the decision was made, but I'm still going to stand by the board and the collective body and how they
consensus.
The consensus of the board.
Right, you can respect the fact that the board made a decision.
And
right? You may not agree with it, but you still respect it.
To me, that's different than going out and advocating against something after it's already been decided. That's to me that I think we want to avoid after a decision is made by the collective body, going out into the community and saying, well, I didn't agree with that, and I think that this was, stupid or whatever. I don't think that is healthy for a board's cohesiveness and professionalism.
I agree with that. It's a hard line for me of saying that the board is telling one of us trustees what we can and can't say outside of this room. Right, so that's kind of where the line is.
I think trustee is in our official capacity.
Yeah, and here's the thing, I can say, because I've been on low side of the vote numerous times, and what I would do if anybody questioned me is I would say, well, I voted against it, it got passed, and so that's what we're doing. The board passed it. And then I don't really say much else.
I still think you should have the right to say what you think.
Well, but I just said that, right? I voted against it.
But you should be able to say your reasons too. I think you should have that that freedom.
But I think there's a difference between stating your reasons for why you voted versus criticizing or whatever other
Right,
semantics you want to use,
Yeah.
criticizing the other person. Those are two different things, right? You can say, I didn't vote for it because these are my beliefs versus
But damn it,
I
Tommy
can't
did
believe
this
that
and
person
I-
voted for it
yeah.
because
Yeah.
them
Well, yeah, that would be
versus
like
you.
devolving into personal
Yeah,
attacks, which I
right.
think we're all
So
on the
you're-
same page not to.
Yeah, so
do
you
that,
can
right?
state why I voted against it. Here's why.
Mhm.
It was approved. It's a board decision. It is what it is. That's totally fine. I think it's not, and I've been on the board when we had a lot of that going on where people were talking smack after decisions and stuff, and it gets real ugly. And so it wouldn't be like, oh, they're a bunch of lunatics, and you don't want to do that kind of stuff because that just makes us all look bad.
Takes away our credibility.
Yeah.
Well, right, I mean, I understand the intent of
Yeah.
what that is, and I
Right.
agree with what all of you are saying. But
Yeah.
you
She's
know,
gonna look
If I
at
could
it.
make
I mean, I got a hard line.
I'll look it
I'm
up.
not gonna ever support
Yeah.
any agreement that tells you what you can and can't say,
Mhm.
period.
Yeah.
So, I mean, yeah, we all agree, we're gonna, I think, but I think we need to work on that. Maybe add the word, respectfully discussed or whatever, because this is all a social contract. We're all kind of signing and agreeing to this stuff, and if we don't agree to it, it's kind of useless. So, but I think that, you don't undermine, or we don't, talk disrespectfully, or we always respect the board's decision because we respect the process, or, whatever, but just saying that somebody can't criticize the decision, because criticize the decision, criticize fellow members, okay, that's maybe a line maybe we should avoid, right, or say, well, I disagree, but criticizing a decision, I think is 100% okay from anybody, anytime.
Yeah, so Cersei is our insurance agent, and we will probably go with what they say.
They addressed this exact topic in the presentation that Sam just did.
Yeah.
So what I will do is resend his presentation
Okay.
to I can send it to all of you, or I can send it to Cindy, and you can use his language or their language.
Yeah.
Or review it or amend, however you guys want to do it, and then we can look at it at the next meeting.
Yeah.
If that would be helpful.
Yeah, they probably have the right language.
Yeah, oh, absolutely.
Yeah. And Max.
This is more of a structuring of this whole conversation, but I believe regardless of what verbiage you settle on with the Sursa verbiage, whatever, that bullet probably shouldn't be under rules of order anyway. I feel like the rules of order is a lot of procedural things, and maybe this tidbit on criticism or whatever could go up under board member conduct, and could be kind of sandwiched in between that professional and ethical behavior. You could have a piece then that extends off of that. That is, once a decision is made, here's how we act as a board,
Okay.
both publicly and on the board.
So where would you make that break in the rules of order?
So
Because
rules
a
of
couple of them sort of speak.
Yeah, so let's see. So I would say the chair I think of rules of order is like Robert's rules of order. That's
Yeah.
So with each member has up to 3 minutes. Discussion continues. Comments. No member may coerce another's votes. I think that's a rule of order still. Criticize another's. That one, the no member may criticize another's question, decision, discussion, or vote. I would almost scratch that.
Yeah, right, put those two together.
And then that would be included in board of contact. So you would scratch the fourth bullet from the bottom. No member may criticize another's question. You may abstain from voting, and then move that second to last one, rephrase it, and move it up to board member conduct.
Well, yeah, because it's kind of the same thing. No member may criticize them. That's the same.
That's the one that you'll rework based on Sursa verbiage, and then move it up to board member conduct.
Can I jump in? I think
Yes.
I think the heading rules of order is throwing everybody off. When I read that and I look at those bullets, that is how we discuss and vote on an issue.
Yeah.
So the reason that second to last one that we're talking about is there is because once we vote on it in that session at that moment, we don't want to just circle the drain. We agree to disagree and we move on. And I think what we're doing is we're pulling that second last bullet out and making it something bigger than it actually is.
So
I agree that it fits there perfectly because in a session, we vote on something, we decide this is how it's gonna go. We don't want somebody to raise their hand again and again and say, I disagree, and to stall the meeting for 2 hours. But, so I think if we change rules of order to something that made a little bit more sense, all those things I think fit in there in how we come to a decision and how we agree.
maybe rules of order then becomes like decision-making process.
Yeah,
or-
something that makes it a little bit
Yeah.
clearer, like this is how we will make decisions, and
Right.
if that's what we decide to go with, that second last bullet makes total sense.
And to the point, you could keep the second to last bullet, take out the criticism bit of it, but just say, once the vote is made, we move forward with the agenda.
We don't
Or
revisit
just-
the issue.
Yeah.
Exactly.
Right, okay.
Again, we'll
Are you-
using
yeah.
some language. I'll just make sure.
But I think there's,
Get it.
what I'm trying to say is like, there's both adjustments that can be made. Like, keep the bullet, but just say once the vote is finished, we move forward with
Yeah.
the agenda.
Exactly.
And we can still add this bit to the board member conduct that is about like, how do we discuss these issues publicly? Like, what should we have our First Amendment rights to say and what should not constitute this?
Right. I am pretty sure after the 8th time seeing Sam Light's presentation, there's something about that exact thing in that presentation.
Yeah.
About like how meetings are run and how to move beyond so that things aren't being brought back up. So I think we should look at that again and maybe utilize that into that as well.
Okay. All right. Okay. Anything else? Daniel, I know you're reading fast.
I didn't see anything else, but yeah,
Okay.
we're gonna
This is going to come back
talk
up.
about it
Yeah.
more.
And
So
we'll talk about
No
it.
decisions.
I think just like comparing that whole SIRSA presentation to the whole document, maybe just see if there's any gaps that
Yeah.
filled or.
Okay. Cool.
So you'll revise and send it to me for the next agenda.
Yes.
I'll send you Sursa tomorrow.
Yeah, if you can send it to me. I think I have it and can lay my hands on it, but just in case.
So you know it's at the top.
All right.
And then if you need more time, just let me know.
Okay.
You could always
What
push it
will
to
happen
August.
when you all finalize your discussion, because these are your protocols, we will run them through legal and through Sursa again, like we did the original protocols, just to make sure that there are no red flags from a liability standpoint or from a legal standpoint. So you guys can take as much time as you need to come to finalize the document, and then when you're done, admin will step in to do the board legal stuff.
Yeah. Yeah.
So I will email you Sursa tomorrow. You'll amend it. Let me know. If you want it in the packet for July 22nd, I will need it by July 16th.
That will not happen.
Yeah. Let's move it to August.
I can tell you that right away.
So it will be on
No
the
hesitation.
August 12th agenda, and I will need it by August 6th.
Okay. Thank you.
Teacher gave you more time.
Right. Thank God. All right. Okay, so not going to vote. Items for the July 22nd meeting, and I do want to just say that I will not be here. But I think
I got it.
will be.
Yep.
Yeah. So we have we've got the joint workshop Mancos Creative District at 5. The consent agenda for June 24, 2026 and July 8. Minutes.
June 2024, did we not do a consent agenda?
Your minutes from the last meeting were not in this packet. They were not done. They were not ready to go.
Yeah.
So we'll put them on the next agenda.
Yeah. And the 2027 capital discussion, including tech in
So
the
I'm
order.
gonna just stick a little note on there that says, board with tech. And then we'll put trustees in parentheses, so to remind myself that that did not come from staff, that that's coming from you all, and then we can chat about that.
Yeah, because I think the two key things are the acoustics in the room and the way in which we have somebody talking with us. Yeah.
I know for a fact that we need 6-inch deep fabric panels, either on the walls or hung from the ceiling.
acoustic panels.
Correct. Now, we can hire a professional to come in and tell me where they need to go, or to start with, we can get some off of Amazon for $30 and put them on the walls and see if that works, because we can all hear the echo right now. So once we dampen the echo, then I will bring in an owl. I believe the owl may be too small for this room.
Yeah.
But I will borrow one from Region 9.
Okay.
Probably not for a board meeting. I may borrow one for a planning commission meeting or tree board meeting to test how that works out. That will be the most economic option that is pretty widely used if we can make an owl work in here. So staff's been doing some research slowly in between the projects, but we have been doing kind of some research this year. So we may have some answers for you for 2027. If we want to hire a professional AV expert to come in here, we are looking at some. It will be a large project, and there's no funding for that. I can't.
Yeah.
Yeah, let's not do that right now.
We'll try. We will make it look professional. I just want to see what we can accomplish before we publish an RFP and get someone in here. So
Those acoustic panels do pretty good.
well, and if the board, this is a priority. We're happy to make it a priority. I'm happy to, budget the money and just make that a project. It was just staff's way of trying to do something not for 6 figures. But it may jump to the point where we need to make that happen, and that's what it's about.
Well, and it would be a benefit way into the future, so, as well as make everything function better in the meantime. So, okay, cool. Anything else that we want? Okay.
Make a motion to adjourn.
I will entertain a motion to
So moved.
Brent.
Wait to recognize, kind sir.
He's trying to slide right in.
Yeah, all right, we are adjourned.